So for the next drug which we are discussing is pharmacology. We'll talk about the drug known as Stavudine. Pharmacology of Stavudine, right? So Stavudine, you should know that it's an antiretroviral drug, and once you term a drug antiretroviral, that means the drug is used in treating what? HIV infections. So it belongs to the nucleoside reverse transcriptase inhibitor class. That means it will block the reverse transcriptase enzyme. Do you understand? So so how does it work? It's a thymidine analog, okay, and when it gets into your system, it has to be converted into its active form. The drug itself is inactive, right? So before it must be converted to the active form, it has to be phosphorylated. Phosphorylated, that means you are adding phosphate. So you add triphosphate, making it what? A Stavudine triphosphate. So it competes with natural nucleotides. Like nucleotides are supposed to go into the DNA so that the virus will keep growing and making copies of itself. So the drug will now compete with those nucleotides. But when this drug gets into the viral DNA, rather, it will cut off the chains. You know, for the virus to be growing, you have the DNA is a chain, right? So it will cut off the DNA of the virus, thereby terminating the activities of the virus. So pharmacokinetics, administration is orally, absorption is good oral bioavailability, distribution is widely distributed, metabolism is to be broken down in the liver, you know, excretion is renal, half-life is about 1 to 2 hours. So that means you can dose it multiple in a day, but it depends on the condition on ground though. So just like I told you guys, antiviral drugs are not as extensive as antibiotics. So most antiviral drugs are just made to tackle just one problem, one disease condition or two disease condition. So this one is just mainly for HIV-1 infection. So it can't even act on HIV-2, just only HIV-1. Well, HIV-1 is much more popular, you know. So it's a HIV-2 that is mainly in just West Africa, you know, so it still serves. So adverse effects can cause headaches, can cause nausea, can cause diarrhea, fatigue, you know. Then they'll write a lot of adverse effects.